podcast for Unit 7 of Surgical Instrumentation, and today we're going to talk about robotic instrumentation. I find this topic to be rather interesting because there's a lot of ways that this can go. So there's going to be a lot of topics that we're going to be covering in this podcast. Just bear with me. I'm going to try to be as thorough as I can, and let's get into it then. This is one of my favorite topics from the course. So essentially, when we think of robotic instrumentation, we think of high cost. We think of complex instrumentation. Um, we tend to think that it's this future technology and that it's very complex sort of a thing. But honestly, with these days, and in this day and age of surgery, robotic instrumentation is actually becoming a lot more common and a lot more available. It's becoming a lot more preferred by different surgeons. According to Steris, 78% of U.S. surgeons express an interest in adopting robotic surgery techniques. And nearly all medical school graduates receive some robotic surgery training. Essentially, these students are going to be learning everything that they need to become the surgeon in the first place, but then they're going to have to learn how to use these robotic surgery and these robotic instruments. And it's one of those things, it's just the day and age that we live in. And so essentially, we're going to be talking about this. Let's get into these topics. Um, so essentially, what I want to talk about is robotic instrumentation. Really worth it? Is it a good investment? Basically, is robotic instrumentation a good investment? This is essentially what I'm going to be talking about in this podcast. So let's get into it. So initially, when you're purchasing these instruments, it's going to be a $2 to $2.5 million investment. And you got to understand that this is going to take some time to actually become, you'll actually be able to see a return on your investment after a few years. This isn't something that's going to be instant. You're not going to see instant results. And then we got to think of the annual cost for maintenance. It's about $100,000 a year. And each accessory for the procedures cost about $700 to $3,500, and this is all according to Steris, using their website. And essentially, the new SBD equipment and the training for the sterile processors and the technicians is going to be $150,000. So essentially, this all comes with a pretty hefty price tag, and in layman's terms, a lot of people might think that it's not worth it. But I honestly think that it is a very good investment. And just with how complex surgery is these days, I think it's definitely one of those competitive markets as well. Um, we need to actually be able to maintain properly educated staff. They have to know how to operate the robotic instrumentation. They have to know how to maintain it. They have to know emergency protocols, this and that. Otherwise, it's not going to be very helpful. So according to Steris, more than 9,500 Da Vinci surgical systems are installed worldwide, and over 10 million robotic-assisted surgical procedures are performed every year. It's the dominant technology today. So essentially, many hospitals might be using the available schedule for the robotic suites, leading one to believe the way to increase revenue and profit is with additional robotic systems. But this is not always the case. It takes more than a doctor and a robot to manage a successful robotic surgery program. And this is based on what Steris is saying on their website. So essentially, when we think about this instrumentation, we're going to realize that this is going to be an investment and there definitely is a chance for there to be a return. So let's talk about the comparison between the number of times that they must be discarded and replaced. And this is regarding the instruments, like the attachments to the instruments. So the main parts of the robot are reusable. They have a limited number of uses, some of these tools and some of these attachments. Usually, some of these tools and attachments have to be discarded and replaced after 50 to 20 times, depending on the instrument. Um, so there's going to be a lot of complex procedures when we're reprocessing these tools. According to Steris, it could take 284 minutes for a set of four instruments to be sterilized. And so we need to see, I guess what I'm trying to say is robotic instrumentation something that is going to be more dominant these days, or when it comes to the difference between traditional surgery methods and robotic surgery, I think that's going to be a very interesting thing. There's definitely a fine line between the two. They both have their advantages and disadvantages. And we've been doing surgery for years and decades with the traditional operating, like basically the surgeon. For a long time, they didn't have these robotic instruments. And so essentially, for a delayed procedure, this is another thing that we have to consider. It's $1,480 to $2,040. And essentially, 4.5 amount of the cases annually, I believe. If there's a 30-minute delay, it could cost the hospital $52,000 just about. And if there's 9% of the cases that are delayed with a 15-minute delay, it could cost around $26,000. So this is another thing that we have to consider. Scheduling is going to be very important, as well as timing. And we need to be on point with this because essentially, um, when we're using this instrument, it's going to cost a lot of money. So we also have to think that there's contracts that come with these robots. Um, Basically, there's maintenance contracts that you can get in. Basically, there's companies that'll make sure that the robot remains operational and properly serviced. So basically, another thing that we have to consider is that since there's a limited use on a lot of these instruments, it's going to drive up the cost per procedure. And so this is just something that we have to continue to consider. Um, so now, so basically, we're going to be talking about another aspect of this, the post-operative advantages and savings. So essentially, with the use of robotic instrumentation, there's going to be shorter hospital stays. There's been several studies, and you could find this on Steris. You could find this on PubMed Health, on Mayo Clinic, that basically say that patients undergoing robotic surgery often have a shorter length in the hospital, and it reduces hospitalization costs for the patient and healthcare system. And basically, there's going to be reduced complications. There's not going to be as many reoperations. There's not going to be as many ICU stays, and there's not going to be a lot of follow-ups. So that's going to lower the cost of treatment, essentially. And the patient is going to benefit all around in this. They're going to be able to return their normal activities or work, and basically, it's going to help the patient to be able to keep up with what they need to do. Um, so it's just one of those things that we have to consider. So a lot of times the hospital stay could be very expensive, and um, essentially this is another thing that we have to consider is the insurance. Many insurance plans, including Medicare, do cover robotic surgery as a form of minimally invasive surgery. However, the level of coverage and the deductible can vary significantly. So patients always need to consult their plan. And as more competitors enter the robotic surgery market, there's going to be increased competition. It's going to essentially drive down the system cost and lower the cost for the hospitals and patients. So yes, essentially what I'm trying to say is The cost per procedure is definitely going to be more expensive. However, like I said, there's going to be a shorter hospital stay, fewer complications, and faster recovery. So it kind of balances itself out. And essentially, they've been using robotic surgery for a few decades now. Let me see. Just going to do a quick little bit of research here. So essentially, the first robotic patient was around 1985, and since then, this field has grown in a lot. So this is from the National Library of Medicine, and there's a system in 1998 that was the Zeus system with arms and surgical instruments controlled by the surgeon. And it basically introduced the concept of the master and the slave, which is the robot. The Zeus system consisted of three arms, each independently attached to the surgical table, having an AESOP arm. And essentially, the Zeus robotics platform was used for the first time in 1998 at the Cleveland Clinic for a uterine tube anastomosis surgery. And then it was essentially going to be used for open heart grafting of the coronary artery. This was done in Canada. And in 2001, a major step in robotic surgery took place when it was called the Operation Lindbergh. So we're going to continue to talk about the cost of traditional surgery. So when we're talking about this topic, there's a lot of trade-offs. Um, so the cost per surgery is definitely going to depend on the procedure. Um, so the average cost for most surgeries associated with the heart is around 57,000. Surgeries related to the knee are around 18,000. And this is from the Library of Medicine database. A hysterectomy costs around 13,000. A partial mastectomy is around $9,000. Hernia surgery is around $8,000. And appendectomy is around $8,000. An ACL knee surgery comes about to $7,000. Um, a cholecystectomy, a cholecystectomy. Hold on, I cannot say this word. Basically, the removal of the gallbladder. A cholecystectomy is around $7,000. Tonsillectomy, basically the removal of the tonsils, is around $6,600. And for cataract surgery, it's around $3,000. So the most expensive surgery, according to this website, is the heart bypass surgery. Um, it's basically performed to treat coronary artery disease, and it's around $57,000. And in Alaska, this cost is around $70,000. So the average price for the patients is around $49,000. Uh, Cataract surgery is one of the least expensive procedures on the list. It's about $3,000, like I said. So essentially, let's compare that to the cost of using robotic instrumentation. So essentially, patients are going to be paying anywhere from $1,000 to $5,000. This could be out of pocket costs. This could be towards their deductible. It really just depends. And robotic abdominal surgery, it's about $2,000 more compared to a laparoscopic surgery. So essentially, this is just something that we have to consider when we're talking about this. And I just find this topic to be very interesting. And essentially, my point here is this instrumentation really worth it? Does it really come as an investment rather than high expense? And essentially, this is going to have to be done over a few years. It's not something that you're going to see right away, like I said. So essentially, my point here is that robotic instrumentation does have a lot of benefits. Yes, it's more expensive, but just as well, it's worth the investment in the long run. It's going to reduce the cost of the trays that they need, the cost of hospital stays. It's going to reduce costs for the patient. And essentially, like I said, a lot more surgeons are becoming more interested in it. So essentially, you got to kind of decide for yourself and look at the figures. Hopefully, that this podcast kind of helped you to understand the difference with the cost analysis between robotic surgery and traditional surgery. And hopefully, I was able to get my point across. So essentially, when it comes down to it, robotic surgery tends to be at least 3 to 5 times more expensive than traditional surgery, and this is according to Steris's data. Um, so yeah, this is my podcast, and hopefully, I was able to cover this topic pretty well. We had a lot of fun doing research on this topic, and this is my presentation for surgical instrumentation. Hopefully, that this topic was clear, and that's all I have. Have a great day, everybody. And we're going to close with Beethoven. Moonlight Sonnet.